And we're live.
Good morning from sunny California, and welcome to our amazing panelist, Professor Aaron Cohen-Gadol. Good morning, Professor. How are you today?
Hi, good morning. Thank you so much for the invitation, Babak. Very honored to be here.
Pleasure. And with us, we also have Professor Abilash Haridas. Good morning.
Good morning, Dr. Kateb, Dr. Cohen-Gadol, and whole team. Thanks for having me, and looking forward to the discussion.
Fabulous. Good morning back to you. And unfortunately, we could not have Dr. Sabaresh with us. He had an emergency and had to rush to the operating room. So we get started with our first series of webinars on AI, and we're delighted to have one of the pioneers in the field from Atlas Institute of Brain and Spine, Dr. Aaron Cohen-Gadol here, and also our immediate past president, Professor Abilash Haridas, 23rd president of Society for Brain Mapping and Therapeutics with us. Dr. Haridas, we had a great conversation with Professor Aaron Cohen-Gadol about collaboration between Society for Brain Mapping and Therapeutics. For a few minutes, I just want to thank you for your leadership and also ask you to elaborate on how two organizations are working together globally.
Great. Thank you, Dr. Kateb. Well, I've been a member of SBNP for several years now, and the past president. And the Society for Brain Mapping and Therapeutic is unique because it has so many members that are primarily focused on the neurosciences, and that's what gives us our strength in numbers and expertise. And of course, Dr. Aaron Cohen-Gadol, a world prominent neurosurgeon, does not need any introduction, has been well respected all over the world. And of course, this initiative with the Atlas Institute of Brain and Spine, it just seemed very natural for us to collaborate because it totally aligns with our goals of not only promoting neurosurgery, which is my specialty, and many people that hopefully are attending, but also to tap into the field of AI. Now, as a neurosurgeon, that's new to me. I'm sure it's new to several folks. And for us to tackle something that big, I think our collaborative makes a tremendous amount of sense. And ultimately, not only are we going to advance the science, but hopefully it'll inspire you to develop your own ideas. And if you have an entrepreneurial spirit, we can help you bring your product to market. And that is really the goal of this webinar, and to give you those ideas and thoughts to go home with. So I'll leave you with that.
Great, great. So, well, last year I gave a keynote in a neurosurgical conference in Egypt, and one of the colleagues, European colleagues, came to me and said, "Well, you're talking about AI. That's so far away, and it's not going to, really impact my practice." So, year after, here we are with Professor Aaron Cohen-Gadol, and he will tell you if you're not on board, you are missing the boat. So with that, it's a great honor to turn the floor to a true pioneer and a world-class neurosurgeon, Dr. Aaron Cohen-Gadol, my friend. Congratulations for launching your own first neurosurgical AI institute and AI practice, I would say, in neurosurgery. And we're all excited to hear and learn from you, my friend. Go ahead.
Thank you, Babak. Very honored. Incredible organization, SBMT, and the initiatives they have done, the amount of effort that's gone onto it by the leadership, including Babak, who has put truly his heart and soul into this organization, and none of these would have been possible without his leadership, of course.
Thank you. Thank you.
Sure. So I think, as physicians, we always question everything. And we are extremely risk averse. And we don't want change. And this has led other organizations outside of medicine to make changes for us. And I'm hoping AI would not be one of those, and we have learned from our previous mistakes not to resist and just question and try to be so resistant not to help ourselves with something that's right in front of our face. There is absolutely no doubt, and again, absolutely no doubt that physicians that employ AI effectively will replace physicians that don't use AI. If you're not using AI to advance your skills, improve your patient care, you are not going to be on the cutting edge of practicing medicine. And today I want to talk to you about a platform that's called Atlas AI Intelligence System, which really is the most advanced model in the current world of AI that can provide hallucination-free, deep answers to our 35 specialties of medicine. We received what is considered sort of the highest level of accomplishment in neurosurgery for part of this work in 2022 from Norway that really demonstrates the global impact of this project. Atlas MD is the first one I'll talk to you about. There's also an Atlas RN. We'll focus Atlas MD, and it is hyper-nuanced agentic AI system. It's not just another large language model. There's a big difference. There's a new era of practicing medicine where we rely on when we don't rely on generic AI softwares like ChatGPT, DeepSeek, OpenEvidence, like AI Expert from what you call UpToDate. Those are generic AI softwares that use simple sort of data and a RAG model to be able to give you answers. This new system is an agentic AI system that uses many different large language models with only peer-reviewed data and peer-reviewed guidelines to provide a very sound, hallucination-free answer that is very reliable. It's been validated by over 1,000 experts, and it's the only platform that can provide reliable answers with zero risk of hallucinations. Why do we need AI? Too much data, too much sort of EHR burnout, many things physicians struggle with every day to try to be more efficient. The constraints that are upon us in medicine are just too large. And to have a co-pilot that you really can rely on is significantly advantageous. This model speaks with the logic of every specialist and provides answer in a clinical workflow format because every specialty is categorized separately. In a review of 100 New England Journal of Medicine's most difficult cases, when you give it to a physician, step by step to ask questions like an oral board format to make a diagnosis, the physician was accurate only 20% of the time, where the AI and doctor were together 90% of the time. ChatGPT was accurate 70% of the time. That's a significant improvement. And the model and the doctor got to the answer 5 times faster. And they saved $500 per patient workup because the model recommended less testing. This is another comparison to another model. In neurosurgery, where we started, for oral board questions, 96% accuracy. The other 4% were judgment calls. They were not hallucinations. And there's no human on earth who has ever scored 96% accuracy on the neurosurgery written board exams. The Atlas is subspecialty level. This is comparing the Atlas to all the other products out there. As you can see, OpenEvidence, ChatGPT Plus, UpToDate. And it's very comprehensive with providing clinical reasoning and the PDF and the link to the PDF of every answer, every statement in the answer. And so the RN is a very similar construct, but uses the nursing guidelines. It's just not repurposed from physicians. And that's very powerful because it really provides an answer for the nurses that's very specific. And I'll show you an example of that. This is the next level. The Atlas Enterprise is creating a private instance of Atlas for a hospital using individual hospitals' policies and standards and guidelines and formularies. So every hospital has their own brain that contains their own data. Therefore, they can really interact with the data generatively rather than using a standard search, and can be integrated into EHR. So this idea of a decision support, it is really the start of a new revolution, which we call the third industrial revolution. And it's a workflow automation system where the agents take over humans and be able to conduct the job a lot more effectively. The guideline-driven answers are obviously the critical aspects of this, and the enterprise level, of course, a critical aspect as well, to make sure that the individual protocols of each hospital are respected. So with that, I want to just go and show you an answer to give you an idea of how this works. I'm going to ask, this is a question I was asked from the nurse persona. Let me see how I can share that with you. Stop share, and then we'll share the other window. So I have a patient with dementia that shows seizures and high temperature. He also refuses to drink. What should I do? This is a nurse asking. So what's the problem for the nurse? This is what the nurse should be thinking about. Tells the nurse what to do with all the dosing, what to do next after the immediate tasks completed, when to notify the physician, and then what to monitor next. What are the sources to assure validity, and what are the key points the nurse should be thinking about taking care of this patient? All of that delivered in a format that the nurse can relate to. Do not, time critical. This has to be done immediately. Make sure the patient doesn't fall, the bloods, the labs need to be drawn, what kind of medicine should be given with the dosing. And then you can also click here and get an opinion from an internal medicine AI doctor. What would the medical doctor recommend when he arrives at the bedside? So the nurse is prepared. This is a very difficult question. I was reviewing this with the oncologist. I have a teenager with ovarian Sertoli Leydig cell tumor with positive peritoneal washing. Is there a role for whole abdominal radiation after chemotherapy? And you can see how every statement has been referenced and effectively is reviewing things in a format that the physician can digest at the level of the clinical workflow. And it's very thorough in the contextual and logic of the oncologist. So this is really primarily what I wanted to share with you and what we have been doing. Obviously, there are other levels of imaging using MRI segmentation, using AI and connecting it to a AI system such as this for automatic imaging and other levels of patient assessment, which will be the next phase of this project. And so, again, Dr. Kateb, I'm very grateful for the opportunity.
Amazing, amazing. Great, great work. I
Thank
know you have spent what 2 decades on this?
Well,
I mean,
it's about 5 years,
5 years.
yes,
But
intensively
on the
5 years.
atlas that you were working on, and then you turned that atlas to AI
Yeah,
model, is that correct? So,
yes,
so this really
yes,
amazing work. So, we have also Dr. Namath Hussain, current president of SPMT, joining. Namath, welcome.
Thank you. Thank you so much. And Aaron, that was an amazing presentation.
thank you.
I think you commended as a great educator in our field of neurosurgery. You've done so much work with the national organizations, with SBMT. You're a consummate gentleman, educator. You
Thank
really,
you.
really want to bring other formats of education to the reader, either through your videos and through this atlas. And so I appreciate you kind of trying to think outside the box and figuring out other avenues of leveraging AI, leveraging the newer technology to help learners learn more, surgeons be better at what they're doing. So I appreciate that, and I laud your efforts.
Great, great.
Thank
So,
you.
we are going to have a little bit of discussion here, and then go to QA from our audience. And I ask from audience to prepare their questions and make it very concise and short, so we can have a short answer, because we tend to wrap this up in next 20 minutes. So just going around the table and talking about the AI. So Dr. Cohen, you talked about the language models. Can
Yes.
you dive deeper into this a little bit in terms of the, I don't know, the transformer structure, or the type of language model that you're using? Is it different than ChatGPT, better, equal? Can you elaborate on that?
Right. So the way these are constructed is that we use a multi-agent RAG model to get the index data that are private and only peer-reviewed to create the response. And then different large language models that are presently used, like DeepSeek, like many different ones that are available, are used to give the answer, but the content doesn't come from the large language model. The large language model is essentially used as the mouth to speak the answer. So that's how we go about not creating another large language model. As you know, that's $1 billion investment that nobody wants to tackle, but use your private data and a large language model to provide very accurate answers.
Mm-hmm. And you talk about um, the predictive modeling and hallucination in the models. So can you expand on what does it mean, an AI hallucination in these models, and how do you use this predictive modeling to basically bring the best answer forward, not get trapped in this type of AI loops that give you a wrong answer?
You know, all the other language models scrape the data from internet and peer-reviewed data open source on internet. That's how they do it. Unfortunately, it's hard to know if they're going to hit a website that is not accurate because it's never gone vetting by subject matter experts. So sometimes these large language models extend information from one topic to conclude an answer that's unrealistic. And that's when the hallucinations happen.
Mhm. And how do you train the system? Is it constantly pulling the PubMed
Every
data,
quarter,
or
every
Mhm.
quarter, we update it under control conditions to make sure everything is, because there is a weighted response. The guidelines are weighted first, then it's the peer-reviewed publications. And so we have to constrain the model not to go outside of the guidelines.
Mhm. Dr. Hussain, what's your thought is in terms of the kind of application of this type of AI or Atlas AI in general in neurosurgery?
I mean, the ideal AI assistant or AI driver or AI companion in the OR would be like another set of hands, another surgeon with you in the OR. I think there's a lot of data out there talking about two surgeon cases, two surgeons for spine surgery, two surgeons for cranial surgery, and how outcomes are much improved because you have two sets of hands, two sets of brains that are working and that are monitoring for complications, um, and also working through the decision-making process of what to do next. And I think the next step would be an intraoperative AI assistant to take the place of that second set of hands to help you decision make on the fly in the OR based on video data, based on auditory data, based on EMG data, based on EEG data, based on data from intraoperative CT scans or intraoperative MRIs, and also ultrasound use. I think all these things are going to be helpful and can be helpful for extensive resection for brain tumors. Should we be going into eloquent cortex? I think, with the onlay of, proctography in our brain mapping for our brain tumor resections, I think that's an extra layer of information that we have to process and we have to deal with while we're dealing with surgery and while we're dealing with blood loss and other issues. And so it's a lot for one human brain to really calculate and absorb and deal with altogether. And I think sometimes our decisions are clouded by the last 5 seconds of the case rather than the last 30 minutes of the case. And there's a lot of literature about the emotions of the surgeon and how that can affect or cloud judgment. And I think the AI is going to be different in that there's less emotional um, baggage and less emotional effect of what's going on in the OR immediately and stress in terms of making the right decision in the OR. So I think that would be the next step is an assistant, another set of brain, another set of potential hands if it got married with robotics in the future, but another decision maker in addition to the surgeon who's being the co-surgeon with the surgeon in the OR, figuring out what's the next step, what we should be looking at, what information that should be presented to the user, to the surgeon. Maybe it's not important for the surgeon to look at the intraoperative MRI. Maybe it's more important for the surgeon to look at the neurophysiology at this point. And so it might weigh different types of information differently. And if you're wearing a headset or wearing some sort of um, augmented reality device to help guide you and give you information in addition to your visual reality, it might highlight an alarm saying, hey, you know what? The tractography says this. This is important now. Pay attention to this. The MRI shows this. The electrophysiology shows this at this point. At different time points throughout the completion of the surgical event, different types of information are going to be more salient. And I think the AI will sift through all that. It takes a lot of brain power to go through and decide what's important, what's not important. And if you have to deal with so many different factors during your surgical experience, it can cloud judgment. And so if we have an AI assistant that is at least collating some live information, giving you maybe a hierarchical kind of list of, hey, what's the most important thing at this stage of the procedure based on your previous user experience, based on, you know, um, data that's saved from your previous cases, how you perform surgery. It's not going to hopefully change the way you are as a surgeon, but you as a surgeon make you better, make you the better version of yourself. That's why I think I have a lot of hopes for AI technology, AI in the OR, and I feel like a lot of that is happening outside the OR, and I'm really excited to see the intraoperative applications and how it can make us better surgeons.
Well said. Very well said.
Mm-hmm. So, Dr. Haridas, your thought on the application of Atlas AI?
Yeah, incredible presentation, Dr. Gadol.
Thank you, Ali.
Just the amount of work that he's put in, and obviously he's been recognized for it. My thoughts in general is, when you look at anything that's shiny and new, which is AI, you have to have a healthy dose of skepticism every time you approach it. So the important thing is that this tool is meant to enhance your abilities. It's not meant to replace your abilities. So that's the first and most important thing. At least I teach all my use this tool to see if you thought of this before the model, and if the model gives you something extra, that's where the educational aspect comes in. And I completely agree with Dr. Cohen-Gadol that the physician that uses AI in the future will replace the physician that does not use it. The question is, what part of that decision-making process becomes your identity? And if you let it become your complete identity, then you lose yourself somewhere in it. And I think like Dr. Hussain pointed out, we have our own experiences as surgeons in the operating room that are very personal to the patient and to the surgeon. And sometimes you see things during surgery that you did not predict. And sometimes you witness outcomes in patients that you did not expect. And these are the things that I feel like AI has not touched the surface at all, because that is a personal journey between the patient and the doctor. And I think if we have the models, that's where the AI cannot touch the human experience. And I think, when you talk about AI nowadays, especially in business, we talk about finance, that's probably the first impact where it might in medicine, probably radiology is going to be where they can look at 1,000 images as opposed to one. So surgery influence will come probably later, but I think it's going to be here quicker than we think. So I'm happy. I'm really excited to be on this journey with all of you to explore those options. And I think for the viewers on the webinar is that this is an opportunity for you to step forward and see where you fit in. And I'm telling that because even I don't know where I fit in right now, but I know that my strength is in neurosurgery. That's what I understand. But you have to be a little bit more open and be flexible about where the field is taking you, because it's going to be completely outside of your comfort zone. And if that's something that entices you, then this is you're listening to the right group of people that are on the same wavelength. So
Great, great. Dr. Aaron Cohen-Gadol, professor, I've got some questions in terms of how the system avoid the bias first, if you don't mind. As you know, in AI, bias is an issue. So how do you avoid that?
Yeah, the model has been adjusted to weigh based on the value of the paper. Is it randomized trial? Is it, systematic review? Is it more recent? Is it old? That's really how it's been scheduled to make sure that the answers are very effective. Bias, if that's what you're referring to as bias, Babak, if you're talking about a different form of bias, I'm happy to answer that as well.
Just like just referencing one sets of answer, and but then in the same question references another sets of answer. So it's kind of there's a little
Inconsistency.
confusion and inconsistency in so yeah.
No, we have multiple augmentation steps to avoid all of that. So the accuracy of yeah, go ahead.
Yeah, sorry. And there is a concept of opacity in AI, meaning that is like a black box of
Yes.
decision making. So can you elaborate about how the decision making in Atlas AI taking place?
Right. The decision making is as such that the model cannot scrape the internet. It can only refer to peer review publication and guidelines. It has to first review the guidelines, then peer review publications, summarize it without using any other source, and make sure it is presented in a format that will give it to that is compatible with the clinical workflow of the clinician.
Fabulous. Great, great. All right. So if panel agrees, we go to questions. And before then, I also want to announce that we have a raffle to give free access to Atlas AI to some of those who are staying all the way to the end. And Dr. Abilash Haridas will announce that. So we are opening the floor to questions. Please make your questions very short and concise so we can answer them as such. So any questions we have here? There is one question I'm reading here. How do you communicate with neurosurgery Copilot Atlas AI on the computer screen or via voicemail?
It's very much similar to ChatGPT. The interface is very similar, as you will see. So exactly the same. There's a prompt and we ask questions and we go from there.
The second question is, the first one was from Dr. Reinhard Schulte. The second question is from Lynette. She is asking, can you lose your intuition to AI?
Can we lose our intuition to AI? That's a very deep and philosophical question that's beyond me. But I'm sure I know there are people that have formed relationships with AI. In other words, they no longer interact with others much and only interact with ChatGPT, for example, and they consider them their intimate companion. So I think all of that exists, but that sometimes explains the underlying psychopathology on the user side. But that's a different problem than what they just asked, using your intuition. I do believe the next generation is going to be less intellectually challenged. Let's put it that way.
Yeah.
Actually, I'll answer that too. That's a very deep and philosophical question, and that echoes on what I brought up earlier. Nothing will replace the relationship a doctor has with their patient. And that's, you are talking to a human at the end of the day, and you're taking care of humans here. So I think intuition is an extremely integral part of medical education. It's part of the oath you take as a physician. So that can never be reversed. And this is where the fine line between AI and empathy and sympathy all come in. At the end of the day, this is a tool meant to help you make a decision about taking care of a patient, but you have to be attuned to not just their symptoms, but also body language, cadence of their voice, because all that is giving you clues as to, how much pain they're in or how, what they're suffering. So, yeah, that's a very, very philosophical question, but yeah, nothing can replace your gut feeling that you have initially, and sometimes you may even have to go against what the AI is telling you, and explore other options that. And who knows, you may add another layer that the AI did not discover, and that's the beauty of the technology. It's not perfect, and only we as humans can make it better. So
I think thanks you, Avi, for your comments. I just wanted to add one thing. I think, just like a tool in the OR, your microscope or your loops, it's something that you're utilizing to make you a better surgeon, to help you experience your reality potentially, for you to see things, for you to organize things, for you to help in terms of cognitive load. I think it's something that you're leveraging, that's available. It's technology that's out there that you're utilizing, and different people utilize it to different levels based on their comfort with technology, based on their comfort with trusting the AI, based on their comfort with, these existential questions. I think different people will have different opinions about this, and we heard some of the opinions, but I think there is a possibility. We are the surgeons, we are the physicians, we are the healers, we are the doctors, and no one, I think, has a crystal ball to know what's going to happen in the far future. We know in the near future, it's a enabling technology. It's a technology to help us safer, make us do better, make us make better decisions. However, we can't forget, again, like everyone had talked about before, that philosophical step of, who would have thought that AI would have been a thing? We always talked about, decision-making assistants in the past, but the how advanced AI is now, ChatGPT is now compared to what we were exposed to in the 80s and 90s, who would have thought, and so who's to say in 2030s or 2050s if we don't have an AI that has an integrated empathy package or has integrated other non-knowledge based or more human-like qualities. No one knows if that'll, and hopefully maybe that'll make us a better empathizers, better in terms of other things as well. But you can never forget that we are physicians, that we have to use the tools around us. We have to use the tools around us ethically with patient consent and peer review in terms of how things are utilized, because we have to have a common understanding among all physicians and with our patients on what we're doing, what we're utilizing, what we're leveraging. But I think in the far future, who knows what some of this technology is capable of, And I think that's a question again for a lot of forward thinkers as well in our community. But what are the limits? How do we draw boundaries? How do we set a limit on what an AI should be used for? Should an AI give us suggestions on how to have a difficult conversation with the family when the patient dies after surgery? I mean, it's a whole host of other kind of ethical issues. Should the AI help us frame questions or help us deal with a patient who had a complication or discuss something with a family member that's HIPAA controlled? These are a lot of things that we're going to have to wrestle with in the future, things that we never had thought that we would have to wrestle with in the past. And I think our normative thoughts on being ethical or the patient-doctor relationship, I think there's some room for that to have some fluidity based on future technologies and AI. I think that the patient-doctor relationship will be there, but I think it may not be the way it is today. It may be a little bit different. The patient-doctor relationship in the future may be a situation where the doctor is the human contact with that patient, and the self, the person who's like them, who's going to discuss things and have that thought about how a family member would feel. And the AI might be an assistant to provide another data point or another decision-making tree on how maybe a decision without empathy or without logic can provide a solution as well. So I think there's a lot of unanswered questions, and I think we have to kind of sit back and kind of take a 360-degree view on what we're dealing with. I think there's a lot of technology out there. There's a lot of potential with AI. There's a lot of unanswered questions. There's a lot of issues with regulations, ethicality, what we should let them do, what we should not let them do, and other forward thinkers, Elon Musk and other people have talked about this on, people were first negative on parts of AI and positive later on. And so I think we should keep an open mind in terms of what AI in the future can do. It may be very different from today. And I think the questions that everyone asked were very, very, very valid. So we should, keep an open mind. And then move forward, and hopefully things will hopefully improve, and we'll leverage AI for the future. But I think this is a great conversation. Appreciate everyone's input.
Okay, so the next question is coming from Dr. Thank you very much, Dr. Hussain. We have a whole bunch of questions. I'm going to go through it, and we're going to be quick to answer them. So Dr. Ahmed Abdur Wahab, and he's asking, can you see a future for AI to perform surgical planning for functional neurosurgery? So, Aaron, you want to take that?
How would it change functional neurosurgery, you said? Is that right?
AI for surgical planning and functional neurosurgery.
Yeah,
you see that coming up?
Absolutely. For automatic brain segmentation, target selection, and planning. I think all of that are coming very effective. And we have been doing some work in that arena as well. But that's the next step. MRI segmentation using automatic AI processes. Therefore, the moment you know where everything is, you can make a good decision on imaging.
Fantastic. So I was actually on the board of a company called AI Med Robotics. And if people look them up, they're first generation AI-based intraoperative, basically precision guided functional neurosurgery. So that is coming up and it's already in the market. So the next question from Mia Navarro, I'm going to answer it here. If there is any challenges to the AI and neurosurgery, what are they and how do you overcome them? Dr. Cohen.
The challenges with AI are how do we compare the results of one AI to the other? There's just all of these AIs are popping up. Decision support, Health Universe is another one that is out there. But when you ask a question, the depth is very minimal. So how do we get some sort of regulation? And I hate the word regulation because that usually kills innovation. But how do we softly put some sort of a metric? How do we compare one compared to the other? Because there are people that just because they have great connections in Silicon Valley can raise a lot of money and just come with a product and be successful, while other people that have a quality product but don't have those connections are left behind. So how do we balance that? I think that's something that's extremely important.
So I think you're probably referring to a standardization or some sort of a standard across the board.
Right.
That would be an interesting. And well, we have Atlas AI, and then the patient going to show up and say, okay, my AI says this, your AI says that. So kind of how do you actually address that issue?
Right. Yeah, that's time will determine that. The users will determine that. It's a free market. Which product is better? It's again, this is such a cutting edge technology that it's hard for government, thanks God, hard for the government to get control of it. But at the same time, there has to be some measures so we can assess one versus the other.
Great, great. So we have about 5, 6 more questions. So what is the protocol in an event of an error? I'm assuming the doctor is held liable for a mistake.
Yeah. Well, just to be honest, doctors make a lot of mistakes. I have made a lot of mistakes. So I think it's one thing that we feel we don't make mistakes and only AI does. Well, I can tell you I've made mistakes myself. AI makes less mistakes than I do. That's the way I look at it. And therefore, the AI is not responsible. The physician is ultimately responsible. But please do remember that physicians make a lot of mistakes.
Great, great. So then, doctor,
the AI is not going to do the surgery for you. You still have to do the surgery. So
Right.
it may
But
help you
he's
make
asking for medical decisions, not necessarily surgery.
yeah. Medical decisions are one thing, but can AI help us prevent a complication during surgery? That's a different question based on the information that you have. So I think that's where the value might come in. So that's a great question.
Okay, so Dr. Audrey Hakimian, she says that as ASI become more common ground, will that not create intuition within the algorithm? So I think we addressed that, but Dr. Cohen, what do you think?
Well, what becomes mainstream again? Could you repeat the first step?
Well, AI become more mainstream. Will that not create intuition within its algorithm?
Yes, it will for sure. It already has. But remember, if all the cars on the street were driven by AI, there will be no car accidents. That's a great thing about AI. The reason we have car accidents is because humans drive. That should give you a
Right.
perspective.
Okay, the next question is from Dr. Misra. Does your Atlas AI has included peer-reviewed material only from the US or include data from other countries, says like from Japan, China, and so on?
We have used the top 10 journals on every specialty. So if any of those based on impact factor include overseas journals, they have been included.
So from Dr. Vicky Yamamoto, our own executive director and 20th president. So wonderful
Yes.
presentation. Are the peer review articles info coming from PubMed, Medline?
Good question.
The reason she's asking is that the recent years we have some articles from BioRx and Medrex, which are meant to disseminate information as soon as possible, which can be useful, but they're not fully peer reviewed. Does the tool exclude these archive article in the PubMed, but not peer reviewed yet?
So it only includes peer-reviewed PubMed material and peer-reviewed society guidelines. That's what it includes. So there's nothing in PubMed that's not peer-reviewed as far as I know. And we have gone through and sieved out anything that's not peer-reviewed, including the one on the society guidelines.
So a couple of questions from Lynette, and we're done here. So she's asking if we can integrate the patient's experience to assist the decision making of the AI, and also with integrative and ecological medicine method be taken into consideration with decision making. Will integrative and ecological medicine method be taken into consideration with decision making? So do you think that the patient experience could be part of this decision making, or other types
there's
of
a lot of
methods?
HIPAA compliant rules and regulations that are very challenging to navigate. And the moment you interact with a patient, you have to really be very careful with all of those regulations. So I think that will be it would come at some point, but it will be more further down the pipeline.
Okay, and last question. Overskilling and dis-skilling could be possible clinical safety risk. That's from Medine Deep Siaxin, if I'm pronouncing her name correctly. Overskilling and dis-skilling could be a possible clinical safety risk. So what your thought on that one?
Overskilling?
I'm not sure what does she mean by overskilling. Maybe overconfidence. I'm not sure. But I mean, I don't see personally. I don't see usage of technology could be a safety issue.
I think what she may be referring to is by de-skilling is maybe we as surgeons rely on AI to such a degree that we ourselves lose some of our clinical skills. And I think that's a real possibility. I think, but you have to kind of find out what skills are important for you to retain at this point, or and what skills that you have are not critical for the patient human and doctor interaction. So it's a possibility, and I think no one knows for sure what's going to happen in the future, but it's possible.
Well, I actually encourage our fellows and interns to read articles, understand the subject, then go to ChatGPT and and use it to see what they are missing. So understanding of the problem is the first thing by reading and educating ourselves, then using the tools, not the other way around. So so I think we are at the end of the QA. And I want to thank Dr. Aaron Cohen-Gadol, Dr. Abilash Haridas, and Dr. Hussain being with us. Dr. Shivaram Prasad, who is our VP of Membership. He is on the call with us and from the Society for Brain Mapping and Therapeutics. He will share the page that shows our membership with the Society. And we're delighted to have collaboration with Atlas Institute of Brain and Spine to have a discount for our members. So, Dr. Shiva, can you share the screen and quickly go over the membership? There we go. Here's the page for Society for Brain Mapping and Therapeutics.
Yes. Hi, everyone. So this is our
Hello.
website. If you were to scroll across to the tab that says Become a Member, it brings up our different membership packages. For students.
And I think these are reasonable membership packages. And all of these presentations that we'll be doing with Atlas Brain and Spine Institute will be archived in our membership portal, plus many other great courses that we will have. So we encourage you to become a member and be part of this amazing collaborative effort. So plus you can get all types of discounts for registration at our annual convention and so on. So with that, I'll turn the floor to, thank you very much, Dr. Rampersad, for your help. Turn the floor to Chad about the discount package we have. And then Dr. Abilash Haridas will announce our winner of our prize today. Go
Thank you very
ahead.
much, Dr. Kateb. I appreciate that. My name's Chad Smith, and I'm the Vice President for Product and Marketing with Atlas Meditech. So if you look into the chat, you'll see a hyperlink put in there by Dr. Cohen, and that is demonstrative of our main landing page where you can see Atlas in action. Feel free to get familiar with the demo feature. And if you like what you've seen so far, of course, we would encourage you to become a subscriber and further support our efforts. We have a free or freemium tier in which you can get 10 questions a month. And once you decide you're ready to commit, we are offering a special promo code for SBMT members that I will also put in the chat, SBMT3 free. That gives you 3 months of our premium monthly offering, normally at $39.99 a month. And you'll have 3 months to really dig in and get used to the product, and please share plenty of feedback because this is for clinicians by clinicians, and we are very excited to further develop and refine our offerings. So go to atlasmeditech.com/atlasgpt and you can get our premium offering for $39.99 a month. And again, that code is SBMT3 free. We will drop that in the chat right now.
Fabulous. Great, great. So I also thank Dr. Abilash Haridas and Dr. Namath Hussain for their participation. So they will announce the raffle. So we'll come back to them when they're ready. So, and also wanted to let you know that we're going to have series of different different panels like this with Dr. Aaron Cohen-Gadol and covering the cancers, brain cancers, spine, psychiatry, kind of going down the platforms. And in our future webinar, we're going to have colleagues from Intel and other prominent companies who are in this area in partnership with Dr. Cohen-Gadol to look at the application of Atlas AI into surgical practice and integration. So, Dr. Cohen-Gadol, a final thought from you. I wanted to obviously thank you about this amazing
Thank you.
opportunity. How do you see this Atlas AI to be integrated with a regular workflow in the clinic, surgical, kind of practice,
Yes.
but also with other, let's say, integrating with other AIs. There are other AIs working on imaging in, as I said, AI robotics and so on. So we could, is it possible to have a kind of a interface?
So I think the app is available on the iPhone, so you can easily talk to the app and get answers. I think the next stage is integration in EHR. That would be the next level for the model to read the data and provide recommendations automatically. I would say those are the two big ones currently. Robotics is a tough one because I think that's going to come later when there's more confidence in AI. Because robotics, things could potentially get out of control if there is any minor issue and there's not enough human oversight. So I think that's going to be further down maybe the next few years.
Great, great. Okay. Well, I think we are excited to have a follow-up on this. And thank you so much. Chad, do we have the name of the winner so we can pass it to Dr. Haridas and Dr. Hussain so they can announce the first name and the last name?
Yes, absolutely.
Yeah. So, and I thank everybody for staying with us. We're excited to have this kind of webinar/podcast moving forward on AI in neurotech, I would say. And excited to collaborate with Dr. Cohen again with his first AI Brain and Spine Institute, which is very, very exciting. Where are you located now?
We're in Los Angeles, California, in the Cedars Tower East, and excited for this phase of life.
Fabulous. Well, welcome aboard and welcome to our territory. So and also when is the ribbon cutting for the office?
Oh, we're not into these stuff. We already had our
I was
first
going to bring
clinic.
a nice little
Yes.
red ribbon for you.
Yeah, probably I should have done that if I was as innovative and entrepreneurial as you are, Babak.
Well,
But I'm
never
a
say
little.
never too late.
That's right. That's right. But thank you again. It's an honor. Look forward to the next
My
one.
pleasure.
Next one, we
Absolutely.
can talk about image segmentation, AI segmentation for MRIs, operative planning, virtual twins, an incredibly exciting new era of twin worlds and how we can simulate reality in the other world. It will be extremely exciting.
Amazing, amazing. This is really fantastic and exciting. So, Dr. Haridas, do you have the first name?
Yeah, we have David is the lucky winner.
Okay, and Dr. Hussain.
And Kona, congratulations.
All
Congratulations.
right. David Kona, you're going to get a nice a code to use this great platform. And congratulations. With that, I just want to, again, thank you, our panelists and our amazing team in the background. Chad Smith, a round of applause for you. And from our side, a great number of team members, Dr. Shivaram Parsad, Dr. Vicky Yamamoto, and from your side, Luke Brown, and who is doing amazing work on the technical side, and of course, Manu Garcia, who is a marketing guru and VP of our marketing. So have a wonderful day and see you next time.
Thank you, everyone.
Bye.
Thank
Thank
you,
you, everyone.
Babak. Take care.